Hi, today we're going to talk about minoxidil. Minoxidil, as you know, is a topical solution which is used for hair growth. Minoxidil was first used for severe recalcitrant hypertension in the 1970s. It was coincidentally discovered that minoxidil, when it was used on these patients with hypertension, it also caused a side effect of increased hair growth. In 80% of the cases, bald men grew some hair, and other people, as well as these bald men, grew hair in other places like the face and the body. So this led researchers to investigate and to find a preparation of minoxidil which would serve their purpose, that is, grow or retain hair, but not the other side effect of growing hair in unwanted areas. So a doctor in Denver, Colorado, United States was the first person to start preparing topical minoxidil solution. It was in 1986 that 2% minoxidil started being used for hair loss. In 1993, 5% minoxidil was started. Both of these drugs became so popular. They both are FDA approved now, and 20 years back started being available across the shelf. A point to note here is that minoxidil is not a DHT blocker. Minoxidil is a vasodilator, that is, it dilates the blood vessels. It is a type of drug which is a stimulator and not a blocker. So it is only used to maintain hair or thicken the existing hair. So this is a very important difference between a stimulator and a DHT blocker. The positive effect of minoxidil is due to its metabolite, minoxidil sulfate. Minoxidil is converted to minoxidil sulfate due to an enzyme which is present in the roots of individuals, and variably so. So this enzyme is called sulfotransferase, which converts minoxidil into minoxidil sulfate, which is the active ingredient of minoxidil. So it has been 35 years since we've started using minoxidil, but we have not been able to establish the exact mechanism of action of minoxidil. However, there have been two postulates. The first postulate is that it is an ATP sensitive potassium channel blocker, which due to hyperpolarization of the cell membrane increases the vascularity around the follicles. The second postulate which has been put forward is that minoxidil increases the expression of VEGF, that is, vascular endothelial growth factor. Now this vascular endothelial growth factor increases the fenestration of capillaries, the capillary network around the follicles, and increases the vascularity around the follicle, leading to more hair growth. Now in so doing, in stimulating the follicles by way of increasing blood supply around them, minoxidil increases the anagen period of the hair. At the same time, it decreases the telogen phase, thereby decreasing the shedding. So at any given time when you're using minoxidil, you'll have more hair than you otherwise would. A point to be noted here is that minoxidil does not encourage regrowth. It only increases the hair shaft diameter. So whatever hair you have on top of the head will appear to be thick. Your head seems to be fuller than it were before using minoxidil. This is an important take-home message. So its mechanism of action is different from the blockers, that is finasteride and dutasteride. What discourages the users of minoxidil most is that when we start minoxidil in the first 3 months, there can be a lot of shedding. Many people would not be very happy with what happens because they've taken it for hair regrowth, and what they're now getting is hair shedding. So they don't take kindly to this fact, and then many people stop using minoxidil at the 3-month mark. Here you have to note that this is the period which is mandatory. This period of shedding is mandatory because still the hair which is thin, weak, is just sitting on your head. There is an initial period of shedding. Why? Because the old hair which was thin is falling off. So if you can sustain yourself up to this period of 3 months shedding, which is mandatory in most cases, you will have very good lush growth on the head in most cases. So when you invested 3 months in using minoxidil regularly, this is not the time to give it up. The response of patients to minoxidil is variable. Every patient is not the same. Every patient's constitution is not the same. Every patient's commitment is not the same. Every person's risk-taking ability is different. So the patient response to varies from person to person. So in my practice, what I found is that 40% of the patients are happy with the use of minoxidil because they get more thickness and their hair looks fuller. So these are the positive responders, and they have no problem in taking minoxidil for a long time. Their compliance is superb. The second group, 30% people, are the people who are ambivalent about its use. They neither accept any difference in increase in thickness, nor do they deny that they are getting a benefit from use of minoxidil. They are happy that their hair is maintained and there is no further hair loss. I classify them as ambivalent responders. The third group of 30% people are those who are very cynical, who are not happy with minoxidil, who say that they have got no response in in having taken minoxidil. This cynical group has to be converted into compliant group. So how do we do it in my practice? In my practice, what I do is I tell them to stop. I insist that they should stop using minoxidil for 1 month. Now, when they stop using minoxidil, they see an increased hair fall, and that is what convinces some of them that this is a good thing to maintain their existing hair, and they become compliant. Everybody doesn't become compliant, but some of these negative responders, they become compliant and take medicine for a longer period. Whatever medicine they use, patients expect a miracle, and they expect a miracle more so from minoxidil. Because, why? Because it is marketed very heavily. So you need to know that it only stabilizes your hair loss. It does not increase regrowth of hair. The frequency of use of minoxidil, I recommend only once a day use in hair loss patients and after hair transplant as well, because minoxidil has a duration of action of 21 hours. So if you use it at night, it is good enough for maintaining your hair. You need not take it twice a day. But if you take it twice a day, there is no harm. If you feel that you are better off taking it twice a day, you are most welcome to do it. It is mentioned also that only 1 milliliter is to be used. Now, this is no hard and fast rule. It is not something that is written in stone. So you have to see how much is the area. See, if your area is big, you might need a little bit more than 1 ml. If your area is small, just half an ml or a quarter of an ml will also do. As long as you are not using too much, it is accepted. Increasing the concentration of minoxidil in the preparation does not always help. Why? Because when you go beyond 5%, the dose response curve flattens out after 5% minoxidil. So your response with 10% minoxidil or 15% minoxidil or 7% minoxidil may not rise as much as you expect it to. It will cause problems like headaches, dizziness, and other miscellaneous problems that are associated with high dosages of minoxidil. So I would advise just 5% taken once a day is sufficient for your hair loss and after hair transplant. Now, the 2% minoxidil that we get under the brand name of Rogaine, which is the most commonly used form of topical minoxidil, is colored pink, and it says minoxidil for women, and it's 2%. Whereas 5% can says it is 5% and for men. However, this is just a commercial trick to sell more of these drugs to people. It does not matter whether you take the 2% minoxidil meant for women or a woman taking 5% minoxidil meant for men. The constituents are the same, and 2% and 5% can be taken by either sex, and there is no problem at all, and that's what most people do after hair transplant. Commonly seen side effect of minoxidil is a lot of itching, dryness and flakiness. Now this really upsets people because they keep scratching the head and the flakes falling over their dress. This happens when you use topical solution which includes propylene glycol. This propylene glycol causes skin sensitivity and leading to these disadvantages. If you use minoxidil foam, there will be no itching, there will be no dryness, there will be no flakiness. Since minoxidil takes up to 90 minutes for it to be absorbed into the skin, you should wait for that period and then engage in other activities where chances of minoxidil coming off are high. So you should wait for 90 minutes before you take a shower, or you go for a swim, or you apply certain hair care products. Though it is not FDA approved for use to increase facial hair, minoxidil can be used for increasing the density of the beard, or in those who have less beard, it can be used. Also for the eyebrows, you can use minoxidil. Now, if you stop minoxidil, depends upon how much is the period for which you have stopped minoxidil, there will be proportionate shedding. When you start using it again, you will continue to have the effects of minoxidil as you had earlier. At the moment the pregnancy test proves positive, you are recommended to stop minoxidil. As it is, it's not going to have any effect during pregnancy. Why? Because during pregnancy the hormones rise and they increase the anagen period, and you have lush hair during the pregnancy. Now this lush hair that you have developed during pregnancy will all fall off the moment the child is born because of shedding. So once the child is born, you are free to restart minoxidil. I hope I could convey to you the points that you wanted to know about minoxidil. If there is something left, I would be very pleased to answer to you. If you can mail me at drbhatti@darlingbuds.com or WhatsApp me at 981-453-1111, or write a comment below and I'll be very happy to answer. Thank you for watching my video again.